So the NEET-PG results are out, and I want to congratulate to all the rankers. A lot of you have asked me whether you should choose emergency medicine as a specialty of choice. So this video is about that. So let's dive in. So who is an emergency physician? You will get told a lot of definitions or a lot of ideas about who an emergency physician might be. But according to my understanding, an emergency physician is somebody who is trained in mix of medicine and anesthesiology and a little bit of surgery. So you get to do a lot of the cool things in these specialties. You get to be a physician, figure out what is causing the ailment in the patient. You get to be an anesthesiologist and take care of a lot of airway issues, lines and all those procedures. And as a surgeon, you get to do a lot of procedures like chest tubes and suturing. And if you're lucky enough, you get to do an emergency thoracotomy or an emergency C-section. So emergency medicine originated in 1965 in the world when people realized that they needed a trained physician to man up the emergency and to save that golden hour, the time in the golden hour. So a lot of the specialties like medicine, anesthesia or surgery grandfathered a specialty called emergency medicine. But in India, it started pretty late. The struggle started in India in around 1990s. And the first fellowship was started in CMC Vellore in around 2000. 2005, Apollo was first hospital to start Masters in Emergency Medicine, with RCEM UK. It was a residency sort of, and, was one of the first courses to start it in India. But emergency medicine was recognized as a postgraduate specialty only in 2009 or 10, when the BJ Medical College in Gujarat started the first MD medicine program, if I'm not mistaken. And then DNB programs were started, and a lot of hospitals joined in with the DNB courses. So, who is an emergency physician? An emergency physician is somebody who is a jack of all trades, does everything which comes through the doors in the emergency to help a patient out. So like every specialty has its pros and cons, emergency medicine also has its pros and cons. Look at this flowchart here. This is how we will discuss the pros and cons of emergency medicine. The best thing about emergency medicine is that it is fast paced. You end up doing a lot in a short span of time, and you necessarily don't have to answer all the questions where the patient's attender might have a lot of questions. You don't have to necessarily answer those questions because the definitive care physician will end up doing that. You revive a patient, you shift them to the definitive care unit, like in the critical care unit, and the definitive care physician, which is the critical care physician, will end up answering a lot of the questions which the patient's attender might have. So that is a pro in my understanding. Although you don't follow the patient up for a long period of time, you might consider it a pro or a con depending upon what you want in life. I consider it a pro because a lot of the slow pace of medicine comes by following up. You get to learn a lot. And we used to go and follow up on our patients who we treated the previous day or in the previous shift after we had moved them to the definitive care unit. And I would suggest that if you choose emergency medicine, you should do the same. But, it becomes a little tedious, a little boring. You lose a lot of interest. So I consider this a pro because you have the freedom to choose and go and follow up the patient, or choose and not follow up the patient. So it's in your hands. If you want to learn, I would highly recommend that you do follow up. Emergency medicine has short shifts. None of that 24, 36, 48 hours crap which we get to see in residency. Most places, like in corporate hospitals or even in government hospitals like in AIIMS Delhi, you have short shifts which last from 6 to 12 hours. Every day though, that is. You end up going to the hospital every day, but for a short period of time, and it is a pro in my understanding. You get to see a lot of varieties in cases. You will end up seeing something from medicine to surgery to obs-gynae to orthopedics, ENT, ophthalmology, from pediatrics to geriatrics. And that is a pro in my understanding because you get to learn a lot of medicine that way. In this day and age of specialities and super specialities, you might want to have a niche. But emergency physicians are supposed to be generalist and jack of all trades. So to see all those patients, it really is beneficial in the long run. You get to see a lot of these patients and you get to learn a lot from them. So it is a pro in my understanding. The variety of cases, from a common fever, common cold, to doing CPR in cardiac arrest, to putting chest tubes in pneumothorax, to resuscitating a sepsis. It is all wonderful, and it is a pro in my understanding. You can have a lasting impact on patient's life by working for a short period of time. The adrenaline rush of saving a life is the brilliant pro of emergency medicine. When you see that patient walk out of the doors of the hospital which you revived a few days ago, I cannot describe it in words, the feeling you get. So it is one of the best things about emergency medicine. You get to do and change lives constantly. The gratitude you get after saving a life, the understanding that how precious life is and how lucky you are. It's one of the pros when you see those life altering moments, or when you get to act in those life altering moments. So it is a pro in my understanding. You choose and do, you make a lot of life altering decisions in the moment. So let's say if you evacuate a tension pneumothorax and you save a patient's life, in that moment it is a life altering decision which you end up making. You don't have to wait and call somebody who would come and do that for you. You get trained to do all those things by yourself, recognize and treat immediately. That is what emergency medicine is all about. And the knowledge that you have made a big difference in somebody's life, it is humbling, I'm telling you. Emergency medicine teaches you a lot about life. Coming to what everybody wants to know about, the money aspect of it. So the good thing about emergency medicine is that it is a very new specialty. Only 14 years have passed since it was recognized, and there are very few recognized degree holders in emergency medicine. So you have jobs and you get paid pretty well compared to many other sub and super specialties. I was making amount which I would probably end up making after critical care already. So you get paid a lot in emergency. The salaries are pretty handsome. It might range from upwards of a lakh to a couple of lakhs or maybe more. I have heard of people who were making approximately 3.5 because they decided to work in a small setup and handle all their emergency and some of their critical care. So that is one of the pluses of emergency medicine. You have good money, and job prospects in almost every part of the country except for the small places. Since emergency medicine is about handling a lot of emergent cases, so you need the volume, and the volume resides mostly in the bigger towns, in the bigger cities. So you have a lot of jobs available in tier 1 and tier 2 cities. Tier 3 cities, you might not have as many jobs, but you can work as a physician. A lot of people want people who can handle emergencies for them in a small town setup and pay more than the larger cities. So the money is good. You don't have to worry about that. It is a big plus in emergency medicine. You always have vacancies in emergency medicine, as far as I can tell in my experience. I can choose to go to any city, any big city in the country, and I will have a job there within a few days. And that is a big plus. The future prospects in emergency medicine are great. Since there are very few qualified people, you have scope of faster promotions in emergency medicine. You get promoted to AP. One of my friend who did emergency medicine with me is now heading a department in the UAE, and it's a big thing, and it is a big plus in my understanding. So you have a lot of future prospects that way. A lot of casualties are changing to the Department of Emergency Medicine. So a new department is coming up every day, and the job prospects are promising. So in 2023 August, NMC put out a circular which de-recognized sort of three specialities: chest and TB, emergency medicine, and PMR. These three specialities were earlier required to have in medical colleges for them to start an MBBS course, but last year it was de-recognized, and medical colleges do not need these specialities to start MBBS courses. It is considered a con, and it is a con, but and I'm aware that Pulmonology Association and even Emergency Medicine Association are fighting tooth and nail, having meetings with NEET IOs and NMC officials to have them reinstated in the compulsory department for medical colleges. So I'm pretty sure in near future we will have this sorted out, and you will have a lot of vacancies in the medical colleges, although you already do, because a lot of the medical colleges have initiated and set up the department of emergency medicine and have jobs in them. Every day I hear of my friends telling me that they received a call from this or that medical colleges giving them a good and a handsome salary to come and join as an assistant professor or a senior resident or something like that. So yes, even though there is a setback here, but I'm pretty sure that this will get sorted out soon, and there will be more vacancies in medical colleges in the future. So I'm letting you know all these things so that you keep these things in mind and while you make and decide to choose emergency medicine. But this should not just be a reason enough for you to not choose it. One of the greatest thing about emergency medicine is that there are always jobs available in many countries in the world. If you are going to do your MRChem, you can land a job super easily in the UK. You can go to Australia, you can go to Dubai or UAE, many other countries. So yes, there are a lot of job prospects in many countries which pay pretty decently. Some of the countries like UAE, you can make 10-12 lakhs and upward of 10-12 lakhs if you want to go as an emergency physician. So yes, that is there. If this is something you are interested in, I would highly recommend emergency medicine as a specialty. Now coming to some of the cons of emergency medicine. Since you work in a fast-paced environment, it is a high-stress job. You have the burden of life in your hands. If you make a bad decision, it can be life-altering. You feel responsible for a life-altering decision for people. It can give you the adrenaline rush. It can give you a lot of joy when you are right, but it can also lead to a lot of disappointment if you are not. So you have to keep that in mind. All that fast-paced I was talking about earlier, it can be a con as well, because you end up overworking yourself. Sometimes you are on your feet most of the time and you get tired of it after a while. It's all good and fancy in your 20s and 30s, but what about your 40s and 50s? Some people move on to administrative positions and get promoted to professors or something like that, and you don't have to run around so much, but still it can be a little bit tiring after a while. So you have to consider it. Since we are a jack of all trade, and in this day and age of specialities and super specialities, you feel deficient when you don't have a complete in and out of certain diseases or certain specialities. So that might be the case with you, and you should consider it while choosing emergency medicine. It's a fast-paced environment, and people are at their worst behaviors because there is a lot going on with them. They are having the worst day. Nobody wants to come to a hospital. When they come to an emergency, they're usually having their worst day and are at their worst behavior. And you might end up facing a lot of that. So you have to consider that if it affects you a lot, or you have to learn to deal with it in the future as you go in your specialty, like I have and many of my friends have. So you get to learn a lot with people dealing as well, when they are at their worst. The pro of emergency medicine is that you work small shifts, but they're ultimately shifts, and you are going to be a shift worker. The problem with shift workers are well known. Shift workers have a lot of diseases, metabolic diseases, cardiovascular diseases. They end up having a shorter lifespan. So, if this is something you are considering, you should know that this is one of the things which might change your life. So, consider that when you are considering emergency medicine as a specialty. In a lot of the hospitals, in corporate hospitals and even in government hospitals, sometimes the roles of emergency physician are not well defined. People might have an issue, there might be politics around that what can you do and do not do. So that might create a problem for you later in your life and you might not like it, but I'm pretty sure that it is there in other specialties as well. So that should not just be a reason enough for you to not choose emergency medicine. Many other specialties end up having a routine that they go to the hospital at 8 a.m. or 9 a.m. and they come back by 6 or 7. But in emergency medicine, that routine will not be there because you will be a shift worker. Some people like their routines, and if you are one of those people, I would suggest that you think of something else and not choose emergency medicine. Setting up private practice might be an issue because you don't have a defined specialty, a defined role. You are not, and you are supposed to be a generalist, so you can become a primary care physician or something like that, but setting up a private practice is a little difficult compared to like in general medicine or something like that. So you should consider that if that is what you want. Being a doctor is a hard job. Being in emergency medicine is sometimes even harder. It's one of the worst specialties in terms of burnout rates. It takes an emotional toll on you when you see a lot of deaths around you, when you see that people don't recognize you for the job that you do, for the work that you do. All your efforts might not be recognized. So you might end up reviving a patient, sending him to cath lab, activating the cath lab, but your effort might be forgotten because after a while you don't see the patients, and when they get discharged they do not come and thank you. So that feels like a wasted effort. So you should consider that, and it might take an emotional tone on people. So you should consider that when choosing emergency medicine as a specialty, if you are one of those people who need recognition. Since it's a new specialty and people look down upon it a lot, in my personal opinion, I felt that a lot of people looked down upon it, thought that I ended up being an emergency physician because I was not getting anything else. But that was not true. Emergency medicine was a choice that I made a long time back, and I loved it. I still love it. So, yes, if that is something which can affect you, you should think of it. Most of the jobs, I'm not saying all, but most of the jobs are there in the corporate hospitals in emergency medicine. And the corporate structure is flawed. You have administrative people sitting on top of you and they want certain things, and the people who bring more money to the hospital, they end up cutting them some slack, but not you. So you might have issues with that, with the whole structuring, the corporate structure of it all. So that is one of the drawbacks of emergency medicine and practicing emergency medicine in this country, and I'm pretty sure in other countries as well, because you don't end up generating direct revenue to the hospital. For the hospital, you are considered not so important for the hospital at times, and that might be an issue. But I'm pretty sure it will change in the future. A lot of emergency departments are restructuring their billing in a way that all the work which is done in the emergencies are billed towards the emergency, and they end up showing how much revenue they are generating, and things are getting sorted out. But it's still a problem, and you should consider it. Because of the nature of emergency medicine and the short shifts, you end up having a lot of good work life balance. You don't receive as many calls as your colleagues who might end up becoming a consultant in medicine or pulmonology or something like that in other subspecialty or orthopedics, telling them that their patient who they operated upon or who is admitted under them is having such and such issue. Once you're out of the hospital, you rarely receive calls, and you have a good work life balance. And if that is something what you want, I would highly recommend emergency medicine as a specialty of choice. So to conclude, emergency medicine is a very good specialty if you want work life balance, If you want to do all the amazing things and not follow up with all the boring things, you want to make a decent amount of money, not like a cardiologist or a neurologist or an oncologist or a radiologist, but yes, definitely good money compared to many other specialties, you should think of emergency medicine. It has a lot of good future prospects. It has a lot of jobs available in the country as well as in out of India. One of the best options if you want to move out of India and be a doctor somewhere in the country like in UAE or UK or Australia. It is one of the best branches to do your post graduation in. Because of these things, I would highly recommend you to choose emergency medicine as a specialty. And there are certain cons, like you might get overwhelmed, you might get looked down upon, you might feel stressful and feel burnt out, you might not have a routine, all the drawbacks of having to work in shifts. So all that is there with emergency medicine. But all in all, emergency medicine is a beautiful specialty. It's a life changing specialty. I would highly suggest you. Obviously, my recommendation is biased because I am an emergency physician. But what else did you expect? I'm telling you my personal experiences. I chose emergency medicine as a specialty. I could have chosen something else, but I did end up choosing emergency medicine. Although I'm not going to lie and tell you that I never regretted it. Some regrets might come once in a while, but all in all, I enjoy it more. I appreciate it more than I ever did. And I appreciate my emergency colleagues, who are well trained and who do life changing work. And the regrets are very small compared to all the good things I end up getting because of choosing emergency medicine. So yes, this is my honest opinion of emergency medicine in India, and I hope this helps. Good luck to all those who will end up choosing emergency medicine. It is getting picked up pretty high these days. It was the same in my time, but because we had very few seats in Delhi, very few places were offering emergency medicine, and there were no MDs other than in names, and only DNBs were available in 3 or 4 good big hospitals. So yes, but now the seats have increased, but still it's getting picked up very high up because people are realizing that it is a good specialty. So I wish you all the very best, and I hope that this was helpful for you. Bye.